Okay, now I'll begin. Welcome to my lecture. I am Dr. Lee Gonho Lee. This subject is how to treat muscle pain with Shao Tang. I am Gonho Lee, a professor Oriental Medicine at Kyung University, South Korea, and PhD Neuroscience and Pharmacology at Seoul National University. I was postdoc at Cornell University College of Medicine. My subject was neuroscience, and as a master degree, my major was Oriental Pharmacy and Immunology at Kyung University, and the bachelor Oriental Pharmacy, Kyung University. Now I'm Oriental herbalist and SCC AOM provider. From bachelor to up to now, my main subject, my interest is to combine Oriental medicine to Western medicine. So this integrative approach will be very helpful to you. I'll deliver a lecture that specifically focuses on the impact of Shao on muscle pain. Throughout this the lecture, I'll explore the reasons why Tang is advantageous in treating muscle pain from the perspective of Oriental medicine in addition to Western medicine. Additionally, I'll introduce the specific compounds of Tang that have proven to be effective in elevating muscle pain along with relevant supporting research papers. So this is integrative approach. Contents. One, what is muscle pain? And two, muscle pain and Tang. And the first, from the perspective of Oriental medicine, insufficiency of yin and yang, this harmony between the liver and the spleen. I'll use laser. Okay. Second, from the perspective of Western medicine, I'll show some research papers that Tang can be beneficial muscle pain as evidence. Compounds related to reduced muscle pain and muscle cramps. And calcium channel and muscle pain and muscle cramps. Calcium channel is a very important factor to cause muscle cramps. So during my lecture, I showed the information. And three clinical applications of Tang. The last summary. Okay, what is pain? Is definition. Muscle pain, which occurs in the muscle area, is a symptom that can manifest in various diseases or disorders. And now I'll show a video. Okay, one moment. This video will help you to understand how muscle cramps will happen. So you can understand the calcium, the contribution of calcium.
Contraction is at the basis of all skeletal movements. Skeletal muscles are composed of muscle fibers, which in turn are made of repetitive functional units called sarcomeres. Each sarcomere contains many parallel, overlapping, thin,
Okay, this is the sarcomere. Sarcomere. It consists of two kinds of filament. The thin is here, actin, and thick filament is this one, myosin. So this actin and myosin comes near. So sliding comes near means that contraction of muscle. During this, then calcium forms here.
And thick myosin filaments. The muscle contracts when these filaments slide past each other, resulting in a shortening of the sarcomere and thus the muscle. This is known as the sliding filament theory. Cross-bridge cycling forms the molecular basis for this sliding movement. Muscle contraction is initiated when muscle fibers are stimulated by a nerve impulse and calcium ions are released.
Okay. Now I'll explain more in details. This is the presynaptic of nerve. So at the end of presynaptic nerve acetylcholine, the neurotransmitter, come here. Then it cause calcium ion to release. So calcium ion binds postsynaptic nerve. So this yellow round circle is a calcium ion.
Released. The troponin units on the actin myofilaments are bound by calcium ions. The binding displaces tropomyosin along the myofilaments, which in turn exposes the myosin binding sites. At this stage,
so this here red circle is the head of myosin. This bind here at the whole of actin filament. So this calcium ion triggers to actin myosin head to reach and bind actin whole, the whole of actin.
Stage, the head of each myosin unit is bound to an ADP and a phosphate molecule remaining from the previous muscular contraction. The myosin heads release these phosphates and bind to the actin myofilaments via the newly exposed myosin binding sites. The two myofilaments glide past one another, propelled by a head-first movement of the myosin units, powered by the chemical energy stored in their heads. As the units move, they release the ADP molecules bound to their heads. The gliding motion is halted when ATP molecules bind to the myosin heads, thus severing the bonds between myosin and actin. The ATP molecules are now decomposed into ADP and phosphate, with the energy released by this reaction stored in the myosin heads, ready to be used in the next cycle of movement. The myosin heads resume their starting positions along the actin myofilament and can now begin a new sequence of actin binding. The presence of further calcium ions will trigger a new cycle.
Okay, so physiologically calcium functions to muscle contraction, but if there is some serious or severe excessive contraction, Then how to solve the problem is to inhibit or reduce the calcium channel. So thus later I'll show the evidence with some papers. So 逍遥甘草汤 some compound found to reduce calcium channel or calcium channel. So it will be very helpful for muscle cramp or muscle pain. Okay, and next one. 芍药甘草汤 is very popular for treating a wide variety of pain syndromes associated with spasms and cramps. This formula is very simple. It consists of only two herbs, balsam and 저우간草. This formula was originally used when the inappropriate use of sweating had injured the blood or in. At present, it is used for any type of pain in calves with blood deficiency or injury to fluid. Now, second, muscle pain and 샤오야오간초탕. The first, from the perspective of Oriental medicine, insufficiency of yin and yang, disharmony between the liver and the spleen. Second, from the perspective of Western medicine, I'll show some research papers as evidence. Compounds related to reduce muscle pain and muscle cramps, and calcium channel related to muscle pain and muscle cramps. Now, from the perspective of Oriental medicine, insufficiency of yin and yang, disharmony between the liver and the spleen. This is 샤오야오간초탕. This is 바이사오야오. Scientific name is Pioneer, Latin Pioneer alba. English name is White Pioneer root. And this one is 저우간草. 저우간草is fried with heat. So 저우간草is roasted radix glycericae, or prepared liquorized root. 저우간草is better than ganchao in the point of tonifying qi. So this is 저우간草contributes to tonify qi, especially the qi of spleen. Composition: balsam is 12 gram, and 저우간草is 12 gram equivalent. But in some text, 저우간草is half of balsam, 6 gram. And dosage, preparation, administration: cook both herbs in 3 cups 600 milliliter of water and reduce it to 1.5 cups 300 milliliter. Take the warm strained decoction in 2 equally divided dosage. 샤오야오간초탕 can relieve various pains, spasms, or cramps due to deficiency of yin and blood and body fluid. This is an overview of this lecture. The cause of deficiencies of yin, blood, and body fluid. This condition may arise as a result of excessive sweating, high fever, or excessive use of exterior releasing herbs. Now I'll use anatomy model. 1 second. This is an anatomy model. In the perspective of Oriental medicine, uh, excessive excessive use of exterior releasing herbs. It cause heat and sweating. Excessive sweating leads cause muscle contraction because of insufficiency of body fluid. So at that time, this formula will be very helpful to recover. Okay, and the function of each herb. Balsam nourishes in tonifies the blood and replenishes body fluids, and the Zheguanchao strengthens the spleen and tonifies qi. The effect of Shao Gan together they relieve spasms and cramps due to deficiency of in blood and body fluid. Now, how Tang works for muscle pain? This is perspective of Oriental medicine. The cause of muscle pain is insufficiency of yin and yang, and disharmony between the liver and the spleen. So, Tang, how to treat is the cause of muscle pain, insufficiency of yin and yang, Balsam nurses in. Yin and yang. Yin means body fluid or blood. That is equal to yin, and yang is qi. So, in the perspective of Oriental medicine, for to recover yin, this Baisao nourishes yin. So it nourishes the blood and it improves the blood circulation and replenishes body fluid. And second, Zhouguanchao, it tonifies qi of middle jiao, especially the spleen. So I use anatomy model. In the perspective of Oriental medicine, Balsa Balsa nourishes body fluid, and blood. And Zhouguanchao tonifies the qi of the middle jiao. Middle jiao means here in the center of the body. So there are liver and the stomach and the spleen. So tonify middle jiao means that tonify here spleen and liver. So as a result, harmonize the middle jiao. Harmonize middle jiao means that spleen, the problem of spleen and liver it will be solved. Next. So the cause of muscle pain, disharmony between the liver and the spleen, spleen. So how to treat? Balsam softens the liver and regulate the liver and the stomach. Liver and stomach, the regulation of here. And the Zhouganchao tonifies the qi of the middle jiao. Middle jiao means this area. So harmonizes the middle jiao. Together, they relieve spasms and cramps due to deficiencies of in blood and body fluid. Now, how to elevate the muscle pain using Shao Balsam actions nourishes the blood, preserves in, softens the liver, and elevates pain. With Balsam, regulates the liver and the spleen and nourishes the muscles. And Zhougancha tonifies and augments the qi of the middle jiao, especially that of the spleen. With Zhougancha for abdominal pain due to this harmony between the liver and the stomach and muscle spasms, especially in the calves muscle due to blood deficiency. Now, this is a research paper that Balsam nourishes blood. How can we understand the abstract, the meaning of Oriental medicine? Nourish blood, nourish in means nourish blood. So this will be helpful to understand this meaning. Platelet anti-aggregatory and blood anticoagulant effects of compounds isolated from Pioneer lactiflora. Pioneer lactiflora is a kind of Pioneer radix. So here, among the abstract, pioneer fluorine, benzoyl pioneerfluorine and benzoyl oxypioneerfluorine. These compounds are isolated from the Pioneer lactiflora. They would collectively contribute to improving blood circulation. So this means to nourish in through their inhibitory effects on both platelet aggregation and the blood coagulation. So I show this paper to understand more the meaning of Oriental medicine. Now, in the perspective of Western medicine, compounds related to reduce muscle pain and muscle cramp. Balsam, the component of the balsam is pioneer fluorine. Is related to reduce muscle pain, and Zhouganchao in glycerin, glycerin in Zhouganchao, and calcium channel related to muscle pain and the muscle cramp. Research papers: 작약감초탕 reduces muscle pain. Here, the source is PubMed. So here is the list of 작약감초탕. The first one is 작약감초탕. This is a Gampo medicine. It's a traditional Japanese medicine, like Oriental medicine. 작약감초탕 is 작약감초탕. As treatment of painful muscle cramps in patients with lumbar spinal stenosis. So, effect of orally administered 작약감초탕 muscle cramps. These two papers show that 샤오야오 간차오탕 is connected to muscle cramps. This journal is 샤오야오 간차오탕 reduces muscle pain. 샤코야코 간초트, this is 샤오야오 간차오탕, as a treatment of painful muscle cramps in patients with lumbar spinal stenosis, and its minimum effective dose. Here, among the abstract, 샤코야코 간초트, 샤오야오 간차오탕, is a Gampo medicine, Japanese medicine, traditional Japanese medicine, which is known to be effective against muscle cramps, as well as cramp pain in the gastrointestinal smooth muscle and the skeletal muscle. So now we can know that 샤오야오 간차오탕 is helpful for both skeletal muscle and smooth muscle. Skeletal muscle is voluntary muscle, and smooth muscle is involuntary muscle, visceral muscle, like stomach, liver, or colon. And here, our data show that 샤오야오 간차오탕 is effective for painful muscle cramps associated with lumbar spinal stenosis. So this 샤오야오 간차오탕 can be beneficial for muscle cramps. I'll show the compound. This is compound derived from 샤오야오 간차오탕, single compound of 샤오야오 간차오탕 to reduce muscle pain. The one is pioneer fluorine in balsao and glycyrrhizin in 저우간차오. These research papers related to pioneer fluorine in balsao and pain. This is a journal of leukocyte biology. Pioneer fluorine relieves LPS-induced inflammatory pain in mice by inhibiting NLRP3 inflammation activation by transient receptor potential vanilloid 1. LPS inflammatory pain. So with this animal model, the researcher treat pioneer fluorine, then he tested. Now we aimed to investigate the analgesic effect of PF. PF means pioneer fluorine, the abbreviation of pioneer fluorine. PF on an inflammatory pain mouse model. So we can so it shows that pioneer fluorine can be beneficial for inflammatory pain. So pioneer fluorine is the compound of balsao. Balsao is one of the 샤오야오 간차오탕. Therefore, 샤오야오 간차오탕 can be beneficial for muscle pain. Next paper. Research papers related to glycyrrhizin in ganchao and pain. Glycyrrhizin, this is 저우간차오, is yellow, more turned more yellow than ganchao. This is glycyrrhizic acid. Glycyrrhizin ameliorates in inflammatory pain by inhibiting microglial activation-mediated inflammatory response by a blockage of the HMG-B1 TLR4 NF-kappa B pathway. Here, recent evidence corroborates the anti-inflammatory and neuroprotective efficacy of glycyrrhizin. So this paper shows that glycyrrhizin is related to the pain. It is helpful to recover pain. Now, I'll show the molecular pathway, how pioniflorin in bile salts reduce pain. This is from the journal. Okay. I'll adjust. Okay. Pioniflorin relieves LPS-induced inflammatory pain in mice by inhibiting NLRP3 inflammation activation by transient receptor potential binyloid 1. This is a schematic diagram to understand these papers. Now, this mark first. This PF is the abbreviation of pioniflorin, is derived from bile cell. This thick black arrow means induced by LPS. LPS trigger inflammation, and this dotted arrow, it means elicited by PF. And this red X mark means inhibited by PF. So this PF pioniflorin affects here. Then the result is to reduce inflammation and pain. So here, this is the pathway, how pioniflorin works in the cell. Here shows the this principle. Schematic diagram of proposed mechanisms for PF on LPS-induced inflammatory pain in mice. This is the Journal of Leukocyte Biology, volume 108. PF treatment significantly reduced TLRPV1 expression here. TLRPV1 expression reduction and intracellular calcium ion levels. Here, this space is intracellular space. So calcium level to reduce the calcium level, and it affects PKC epsilon. So this affects here. So P65 reduction. So it affects NLRP3. So this cause here cytokine production reduction. So pro-interleukin, IL means interleukin 1 beta, and TNF alpha and interleukin 6. So here, NLPR3 inflammation activation and caspase 11 mediated non-canonical inflammation activation here and here. So then leading to significant attenuation of cytokine production here. Significant attenuation of this is cytokine production in mice with inflammatory pain. So it shows that pioniflorin derived from bile cell reduce inflammatory pain. This is the pathway, molecular pathway. So in the not only perspective of Oriental medicine, but also Western medicine, by Shao Tang can be beneficial for muscle pain, or inflammatory pain, and muscle cramps. And from the perspective of Western medicine, now I showed that calcium channel is connected to muscle pain. So at the beginning of this lecture, I showed video how muscle contraction happen. So the calcium contributes to muscle contraction. So that is a physiological action, but excessive calcium cause to muscle cramps. So to reduce calcium activation, it will be helpful muscle cramps or muscle pain. So this content is related to muscle pain and muscle cramps. Okay. After commenting this paper, then it is better to take a break time. This journal, Journal of Nature Medicine, effects of 작약감초탕, and is observed components on twitch contractions induced by physiological calcium release in red skeletal muscle. So this paper shows that 작약감초탕 is related to muscle cramps. Abstract, 샤오야간초탕 is a campo medicine composed of equal proportions. Equal proportion means that 12 gram and the same 12 gram. But some text, 조간차오 is a half of 발사오. 그리스리자의 라딕스 and pioneer 라딕스. A double-blind study reported that SKT significantly ameliorated painful muscle cramp in cirrhosis patients. So here we can find that 샤오야감초탕 is beneficial for smooth muscle. Here, we also investigated the effects of SKT, 샤오야간초탕, and its components on the twitch contraction induced by physiological calcium release. So, calcium release is responsible for muscle contraction. Okay, now it's better to stop here and take break time, 15 minutes, then we'll start again. Okay. Yes. Okay. Now I show the screen. Okay. Now I keep to explain how the calcium ion or calcium channel works for muscle contraction and muscle cramps. So this journal this paper shows that calcium channel is related to muscle cramps. Now, let's see here. Is research letter 8 years ago, October. Effect of calcium channel blockade on bismodizib induced muscle cramps. Bismodizib is inhibitor here. Aberrant hedgehog pathway signal here. Bismodizib. Now I use this. Okay, yeah. Bismodizib, an oral HH. HH is here. Aberrant hedgehog pathway inhibitor. This is approved by Food and Drug Administration for the treatment of locally advanced and metastatic basal cell carcinomas. This drug, but the side effect of bismodizib is muscle cramps. Here, one of the major adverse effects of bismodizib is severe muscle cramps. Currently, there is no treatment for this adverse effect, often resulting in drug therapy discontinuation. So the problem is how to solve these muscle cramps. This shows one strategy to block calcium channel. Here, our objective was to evaluate the course of muscle cramps in our cohort of bismodizib treated patients and to investigate whether the calcium channel blocker. This shows that muscle cramps is related to a calcium channel. To reduce muscle cramps is to block calcium channel. Now, next papers. This molecular medicine report, 2019, effects of pioneerfluorine on the activity of muscle strips in intracellular calcium ion concentration and L-type voltage-sensitive calcium ion channels in the sphincter of hypercholesteremic rabies. Even though you are unfamiliar with this experiment, but it is important to know this principle. Let's see. The keyword is pioneerfluorine and calcium ion and muscle stripe. So muscle cramps, calcium channel, and pioneerfluorine. So balsam, the compound pioneerfluorine is the ingredient of balsam. Balsam is one of herbs of 芍药甘草汤. Now, the results of the present study demonstrated that PF is pioneerfluorine, induced the relaxation of SO muscle. SO is here, sphincter of OD. Okay, strips and reduced the intracellular calcium concentration in the SO muscle cells of HCl rabies. HC is the abbreviation of here, the cholesterolomic HC is. So these results suggested that the mechanism underlying the relaxation of the SO muscle by pioneerfluorine may be associated with the reduction of calcium ion influx by L-type calcium channels. So through these papers, we can find that how to solve the problem muscle cramps or muscle spasms is to reduce calcium concentration or to block calcium channel, but that is not complete, not perfect, perfect one way. Because it depends upon the patient condition, or we should check all another thing. Now, this paper stating the relationship between muscle cramps and calcium channels. Muscle pain and muscle cramps are related to each other. These muscle cramps are associated with activation of calcium channels. Pioniflorin and glycyrrhizin in Shao Tang inhibit calcium channel, thereby alleviating muscle cramps. This suggests that Tang is effective for muscle pain, as it addresses one of the main contributors to muscle cramps, which are a significant factor in muscle pain. Now, I show clinical applications of Tang. Even though Tang consists of only 2 herbs, but its function varies. Function is very wide. Both the skeletal muscle and smooth muscle and pain, bone and joint pain. Clinical applications: 1. Pain and discomfort from spasms of skeletal muscle, voluntary muscle, spasms, cramps, convulsions, and frozen shoulder, periarthritis of the shoulder systema, restless leg syndrome, acute lumbar strain. Now, the second is smooth muscle. It's involuntary muscle. So, so most smooth muscle, visceral organ, our inner body, like a stomach, liver, colon, intestine. So here, pain often severe from smooth muscle spasm, stomach and intestinal cramps, chronic atrophic gastritis, constipation. It is beneficial for constipation because it contributes the movement of colon. Peptic ulcers, atrophic gastritis, bronchial asthma. It is good for asthma because it helps to release the smooth muscle of trachea, bronchial and lung and pertussis, ulcerative colitis, and stage hepatic carcinoma, and threatened miscarriage. The third is bone and joint pain, such as rheumatoid arthritis, heel pain, cervical spine syndrome, necrosis of the femoral head, and disc diseases. So it varies variety of area in our body. Shao Tang is very, very good prescription. Modification. 이 샤오야가온차탕 consists of only 2 herbs. So adding some herbs, then we can apply to another disease. For spasms and cramps of the extremities, add cecin. Cecin is let's add Rhizoma asari and ganjang, Rhizoma gingivalis. This property, cecin and ganjang, is warm. So it will help our body to become warm, and it activates the blood circulation. So we feel cold or cough, then this cecin and ganjang is beneficial. If there is dysuria, add baijiu and furin. With back pain, add dojong, niusi, and yanuso. Yanuso contains some compound for pain. It's very, very good. With neck and shoulder pain, add gergan or gergan tang. Gergan contains some hormone. With severe pain and yanuso, for traumatic injuries involving bone fractures, add luxiang and moyao. These two materials contains some kind of good component, good compound for pain. For dysmenorrhea, add shampoo. For pain from kidney stones, add during Tang, Haijinsa, Jinqian Chao, and Jinajin. Toxicology. According to toxicology studies in mice, the use of the formula created less side effects than the use of the herbs individually. So this formula is safe. Summary. First, 샤오야오간초탕 is effective for muscle pain. Research papers, I showed some papers that 샤오야오간초탕 reduces muscle pain. Research papers states that 샤오야오간초탕 elevates muscle pain. And second, another papers provide evidence that the compounds such as pioneer in Shao and glycyrine in Chao reduce pain. And second, muscle pain is related to calcium release. Calcium contributes to muscle contraction. If it's severe, contraction is so severe, then it causes pain, muscle pain. So block or reduce calcium ion or calcium channel, then it will be helpful to reduce muscle pain or muscle cramps. Among the ingredients of 샤오야간초탕, by Shao contains pioneer, which have the function of inhibiting calcium release. Zhouganchao contains glycyrine. And second, hence, it is possible to verify the medical evidence supporting the effectiveness of 샤오야오간초탕 in elevating muscle pain due to its components that inhibit calcium release, a potential trigger for muscle pain. Okay. Now is the That's the slide for this lecture. So I showed that 芍药甘草汤 can be beneficial muscle cramps, muscle spasm, and muscle pain. So even though this formula is simple, it consists of only 2 herbs, but its benefit is wide. Not only skeletal muscle, but also smooth muscle. Smooth muscle. So in our inner body, visceral organ. So I encourage you to use this formula in many area, in many diseases. Okay, now I stop my my lecture, my presentation. Yes.
Is there a pharmacological correlation to 芍药甘草汤 and electrolytes?
Electrolyte.
Oftentimes we use electrolytes to nourish our muscles when there's cramps and things like that, right? From
yes.
a Western perspective. So I'm just curious.
No, I'm sorry I'm sorry that I cannot find the papers associated with your question, but it's possible to guess that get these 2 herbs contributes to reduce muscle pain. So in the point of molecular biology, muscle cramps is associated with calcium channel. So calcium is so in the point of electrolyte affects channel or gate So some compounds like pioneer or glycyrrhizin or glycerylactinic acid in ganchao, maybe, or unknown compound in these herbs will affect some ion or some channel. So that is a very interesting subject to investigate. So in clinical studies, this this formula is very helpful for muscle cramps. Then muscle cramp is associated with the electrolyte. So the first one is calcium and more acetylcholine, the neurotransmitter. So if some compound trigger neurotransmitter like acetylcholine or calcium vesicle or calcium ion or calcium channel, then we can find the relation with electrolyte and some compound of 芍药甘草汤. Okay.
Okay. Thank you.
Okay. And another, yes, understand? Yes.
Hi. I was just curious.
I'm very sorry. I cannot hear clearly.
Oh, I'm sorry. I wanted to
Yes.
find out have you ever used the Shao Tang, say correctly, for patients who suffer from pain in the sacrum as well as infection?
I'm very sorry. Please, please talk to me, Dr. Lee. Please
Yes.
talk to me in English again.
Yeah, so the Jacqueline was asking you regarding the clinical experience of the muscle pain on the sacrum and which one?
The sacrum and for bone infections as well as pain in the sacrum.
Pain in the sacrum and bone infection.
Me?
근육통증.
Me?
Yes.
My experience or
With that formula.
my own experience.
Yes.
Oh, there's many cases to recover muscle cramps or muscle spasms. Muscle pain is associated with severe muscle cramps or spasms. So, but bone correction, bone fracture is another problem. So if some patient feels muscle pain, if muscle pain is derived from muscle cramps, then this this formula is very helpful because this Shao and Zhougan nourishes blood flow and blood fluid. Then the muscle cramps or muscle spasms will be solved. But bone fracture is completely
Not the
another.
bone fracture, but the bone infection.
Infection.
Yes.
Infection. Even though we read the inflammatory activity of pioneer fluorine, but infection is different from muscle cramps or muscle spasm or muscle pain. If muscle pain is associated with infection by a virus or a bacteria, that in that case another herbs like lonicera flores or Forsythia. That herbs contains inflammatory, anti-inflammatory activity, compounds of anti-inflammatory activity. So this formula, 샤오야간초탕, pioneer radix and glycerica radix. I think that it is. I'm not sure it is enough to recover inflammatory disease. So infection is another thing.
Can you ask them about bed sores? Does it help for bed sores? Bed sores. Wound sores in the patient.
Hello?
Yes.
And then another question from the Jacqueline is
Yes.
The bed sores. Like if the inpatient patient stay on the bed for a long time, feels more the soreness. And is the 작약감초탕 can be helpful for those the long-term, the inpatient with the bed sores?
Bed sores? Bed sores means
That
wounds that come with your life out.
그 입원 환자들이 너무 오래 누워 있어서 아픈 것도 작약감초탕으로 해결이 될지 해서요.
I think that it will be helpful for some duration and some dosage. Every drug even though it is medicinal herbs, it's necessary to keep the dosage duration. So if the patient stays in the bed a long time, they can feel pain, back pain, or muscle pain. So this formula will be helpful in some duration, but please check after administration. Then please check. Then the problem is solved, is continued, or is stopped. So this side effects less, but more and more dosage is not needed, because 저우간차오 has the activity of water retention. Water retention cause hypertension. So you know aldosteronism is moon phase. Ganchao contains some hormone, so it cause water retention, so it leads to edema. So 저간차오, 간차오 is constituents of 샤오간초탕. So please please check the duration of administration. Yes, so in that case, in your question, for the patient to feel back pain for a long stay, then this formula will be helpful. Yes.
So you mentioned hypertension. What if the patient has hypotension? Can they take that?
Is this formula also can be helpful for the low blood pressure, hypotension?
Hypotension, not hyper. Right. Maybe it will be helpful, because as I mentioned, balsam nourishes in like body fluid or blood. So it will trigger balsam. It will trigger the blood circulation. So it will be helpful for hypotension, and 즈간차오, not 간차오. Roasted ganchao is 저우간차오. 저우간차오 is to tonify qi. Tonify qi means that it triggers or stimulates blood circulation. So these two herbs will be helpful for hypotension. But please check the duration, because as I told you, 저우간차오 cause water retention, so edema. Yes. Okay.
Well, let's see if anybody else.
Oh, please.
Hello?
Oh, yes.
Hello, yes. This is Dr. Laura Binksolo. I have a question regarding Shao-Tang and calcium channel blockers. If you have a patient that's on a calcium channel blocker, would that be contraindicated?
Please communicate again in English, Dr. Lee.
So Dr. Laura, you're asking about whether it's contraindicated to use the calcium channel blocker medication with this formula?
Yes.
그 칼슘 채널 블로커 그 약이랑 같이 써도 되는지 해서요.
This is Western with Western drug and Oriental drug. So in the point of body, the blood concentration is very important for a patient. So whether it is Western drug or Oriental medicine, it reaches the blood. So some compound Western drug, the compound of Western drug, and some compound of Oriental medicine will reach in the blood. So the blood concentration is significant. So please check the dosage. If Western drug adding Oriental medicine by 샤오药甘草汤, then please check the dosage because two medicine activate in the blood. The blood concentration becomes higher than before.
Okay.
So if so if Western drug is not enough to recover the syndrome, the muscle pain, then add 샤오药甘草汤daily, but from a small dosage, then increase dosage little by little. And check day by check. But this side effect is low. But okay, please check. Yes.
Okay, thank you very much.
You're welcome. Yes.
Back off her question, because I'm on the calcium channel blocker. So that was going to be my next question. Probably want to tell me. So I suffer with heart palpitations because of Pfizer vaccine, which causes me. And they put me on a calcium channel blocker, which is this. And it's real exam with the Shao, if I'm saying it correctly.
So basically what the comment is that we need to be careful on the dosage when the patient is taking the calcium channel blocker.
They counteract.
So is there the counteract?
Counteracts is significant subject for in pharmacology. Okay, calcium channel. I showed that by 샤오药甘草汤is related to calcium channel, but there is some evidence in details related to calcium channel and 샤오药甘草汤. Okay. Later I'll think over and I'll search for some papers.
Thank you. And then most of my low back pain patient, they also suffer either the swelling on the knees or the other types of the swelling. So for this group of the patient, better not to use the 샤오药甘草汤.
There are two things to consider. If the edema is caused by long stay in the on the bed, the problem is caused by the low blood circulation. because while the blood is moving, then by the osmotic pressure, it absorbs the intracellular fluid into blood, into blood vessel. But in case of long stay patient on the bed, their staying, their postures cause edema because of low blood circulation. In this case, 샤오야오간차오탕 will be helpful because Shao triggers or stimulate blood circulation. So it will be helpful to reduce edema. But please check. Zhougan has the activity to cause water retention. Water retention leads to edema. So after administration of 샤오야간차오탕, then please check how this patient recover, and there is any more edema than before. Okay.
And he's referring to that patient, just to let him know that some of the primary system that they have brought in that, and that's what they blood pressure.
About the treatment.
No, he was out like they're going to bed for a long time. So we're going to have to take both patients to pressure doctor like 50 or 20. That's how bad it's gotten. So if you want to directing that one, needs to be pressure stay high. So I was curious because with the bone infections, is that the one that we were at that one. That's basically saying the height and she's on fentanyl and stuff like that. It's her case is complicated.
And then I believe that in our the school we're teaching the 샤오야간초탕 the 1-to-1 ratio. And any suggestion about the keeping the 1-to-1 ratio or 2-to-1 ratio?
Baisao and Zhouganchao?
Yes.
Some textbook written in English. There is two types. The one is equivalent dosage. Baisao 12 gram and Zhouganchao 12. Same dosage, but in some textbook, Zhouganchao is half of Baisao. So we can think the difference between them. Why the dosage of Zhouganchao is different? It is less than Baisao, because Zhouganchao the function is to tonify qi, and the second is harmonize spleen and liver. So, but another function is to antidiuretic. So water retention. So if the patient appears that muscle cramps or muscle spasms, muscle pain is severe, then the dosage is equivalent. But this patient has some edema or swelling, then Zhouganchao, the dosage of Zhouganchao is half of Baisao is better. And Zhouganchao is better than Ganchao to tonify qi, for vitality. Okay.
Oh, it's totally different from this. As we work.
And then one of the paper you brought, there's
Yes.
the cytokine, like an inflammation, and then the cytokine.
Yes.
So can it be relevant to the cytokine storm or the post-COVID, like long-term the COVID, the symptoms?
Once again.
So some
You
of
mentioned this one or another cytokine? This one?
yes, the
Ah, yes.
attenuation of the
Yes.
cytokine reaction.
Mhm.
So I was wondering whether the 芍药甘草汤 can be relevant to the long-term COVID the patients.
Long-term COVID.
Yes, or
Your question is associated with long-term COVID?
yes,
Oh.
somewhat I heard about so many people talks about the cytokine the storm.
Yes.
Mm.
Yes. It's called the cytokine storm. Cytokine is associated with inflammatory disease. Inflammatory is
Dr. Laura, can you help us to mute one of the
Yes.
yes the maybe their cell phone or the laptop? Can you mute one of the your computer, please?
Sure.
Thank you.
Yeah.
yes. Cytokine storm is related to many various disease. But in this presentation, pioneering reduce inflammatory pain through by a cytokine production, reduction of a cytokine production. Cases differ from each other, because COVID virus is changes in various ways. So from the beginning of COVID is COVID-19, but after then another virus is changed to another virus. So in the case for development of COVID-19, then many researchers involved and tried. It took a long time. So in this presentation, inflammation, pain reduce is different from that case of COVID-19. If we think medicinal drug that is helpful for COVID-19 is lonicera-flos, medicine of Oriental medicine, lonicera-flos, or Forsythia. Forsythia, those medicinal herbs contains anti-inflammatory activity, a compound of anti-inflammatory activity. But this pioneer I did not find the papers related to pioneer related to the statement that pioneer is helpful for recovering COVID-19 or that virus. So even though in this schematic diagram there is a cytokine production, but that is different from COVID-19. So this pioneer fluorine is one of ingredients of Shao. Shao is the constituent of Shao Ganchaotang. Even though pioneer fluorine has the activity of reduction of cytokine production, but maybe that is that itself is not enough to recover COVID-19 long-term COVID-19 disease. It's not simple. It's not simple question. Yes. Yes.
And then the slides regarding the modification. And would you give us a little bit more like the details? Like
Yes.
most of the patients are with the muscle pain, like neck
Yes.
pain or the wrist pain or the knee pains.
Yes.
So can you a little bit give us a little bit more information about how we can modify? I showed these modifications and adding some medicinal herbs to another disease, then So
for example, back pain or muscle pain, uh, that the patient, if the patient is worker, use muscle severely or work, then it's better to use how can I say in English name? It's a 쌍화탕. 쌍화탕 contains 수우탕, adding astragalli, radix, and nusi. So there is one ingredients of 샤오야오 간차오탕, that is 발사오. 발사오 is one of 수우탕. So 수우탕 adding astragalli and nusi is 쌍화탕. 쌍화탕 is very beneficial for workers. Those who work every day or excessive work, then it cause severe muscle pain, shoulder, especially back pain, or leg. Then 쌍화탕 is beneficial. And another thing, back pain. For back pain is 독활기생탕. or 오약순기산 is Korean name, 오약순기산. And if the patient has swelling in the leg, then 빈소산 is better. Or 오적산. If the patient is feels cold and body temperature is a little bit low, then has a stomach ache, then this 오적산 is better. So there are many prescriptions, many formulas dependent on the condition, the patient condition, or the syndromes. It differs from each other. So the first formula that I recommend is to use 샤오야간차탕. That is common, and its function is good, and the side effect is low. But please check. So after administration, then 3 days or 1 week later, then check the patient condition. So decide whether we continue to administer or not. Yes, and this
So checking every week.
yes, it's required. Somebody say oriental medicine, medicinal herb is not dangerous, but it's okay, but it's better to check, because some medicinal herbs has side effect. So dosage is important. In Western medicine, the dosage is very important. So in Oriental medicine, it's okay. Check. And this gorgon is also useful for muscle pain. It's a single herb. It is good. Gorgon.
Okay.
Gorgon.
And recently, I encountered many low back pain patients with the sciatica. So I also often use the GB30, the Hwando, with the like a very long needle. So do you recommend any modification for this the sciatica 좌골신경통 patient?
In some case, if sciatica is not severe, 샤오야오간차오탕 is good. It's good. But if the nerve that connected to leg and foot, if the nerve is severely pushed,
Suppress.
yes, pressed, then 샤오야오간차오탕 is beneficial a little. So in that case, with acupuncture therapy is better, so in any case of muscle pain, the first prescription is 샤오야오간차오탕 is good. It's good. I recommend. But in case of the symptoms, back pain or leg pain, or foot or shoulder, the pathway or the principle is differ from each other. So there are many prescription formulas that we should choose, decide to which one is better.
Your question?
Yes, when treating a patient with chronic low back pain who gets infrared light therapy, can that be combined with the 샤오야오간차오탕?
So her question is using the infra lights. Any the comments about using the infra lights with the 샤오야오간차오탕 for the low back pain?
Infrared light?
infra lights.
Infrared light.
적외선 치료기.
It will be helpful to use that device, because if the patient is pale, or feel cold, then in that case, a heating device is helpful to recover. So use those two medicinal herbs, 샤오야간짜우탕, and that device will be synchronized. So it will be better. Yes. The light triggers blood vessel by heat, so it warms, then the blood vessel is widened, is become wide, so the blood flow is more, blood flow moves more than before. So the blood circulation is better than the before. Then the symptom will be recovered more easily. Yes.
Thank you.
In the previous slides regarding the showing the chemical structure
Yes.
of the pioniflorin or the glyceric acid, and we often encounter seeing those the chemical structure, but I don't know how to utilize and how to understand. And would you give us some like a guidelines?
That is related to biochemistry or organic chemistry. So this natural oriental medicine is related to natural products. So this chemical, this structural compound, in this case, this is glyceric acid. So now here you can see five link, 1, 2, 3, 4, 5. So here 1, 2, 3, 4 is the structure of steroid, and adding one is a saponin. So this glyceric acid is a kind of saponin. So why I commented water retention of ganchao, then this glyceric acid is a kind of is similar to steroid. So moon phase or aldosteronism is caused by some steroid. Ganchao contains some steroid. So we can find the structure of this glyceric acid. It has the steroidal compound here. So the dosage, why I commented dosage of 샤오야간초탕, it has ganchao. Ganchao has the compound that have activity for water retention, that is related to this steroidal compound. And glycyrrhizin, the compound has glucose, so the molecular weight is higher. So it is not easy to absorb in body. So bioavailability is low. So if you administer ganchao it flows in our body and it absorbs in the villi of small intestine, then the observance, the bioavailability is low, but in colon, there are some bacteria. They cleave the bond of glycyrine, cleave. So the glucose is deleted, is cleaved and deleted. So the compound become to be absorbed more easily in our body, and this COOH here, this hydrogen is can be removed easily. So another chemical react here, but okay, but it's not enough. Each compound how they work in our body biochemically is very heavy or difficult subject to investigate. So that is one of subject to study. So your question is very valuable. Okay.
And when we suggest the 芍药甘草汤 to the patient, shall we recommend to take on the daytime or the nighttime? And when you use the powder form and the liquid form, would you give us share your the clinical experience?
The form is liquid. Liquid is better than powder because if patient if the powder is administered, then it should be dissolved in our stomach first stage, then it moves to small intestine, then from the villi, the compounds of 샤오야간차오탕 should be absorbed in villi of small intestine. So there is more step than liquid form, but liquid form actually it is dissolved before administration, so it can be absorbed more than a powder. But for some patient do not like liquid because of the smell or the taste. Then okay, powder is the second choice, and the time. In my case, twice a day, after breakfast, half an hour or 1 hour after breakfast, and supper, evening. So two times. Two times is enough. I think that. Yes. Okay.
And then, what is the relevant tongue and pulse diagnosis or the 4-type constitution? Shaoyin type people or Taiyang type people? Would you give us the comments about the relevant diagnosis?
Only tongue or
Tongue, pulse, and then the 4 types.
I'm the professionalist of four type medicine, but generally Tang and Shaoyang, Taiyang and Shaoyang is active, so active and easy to move than so Shaoyin or Taemin, Taein. Taein is the body. Body is Shaoyin is thin, thin and feels cool, cool than Taein or Shaoyin, and Shaoyin is calm and prefer to stay to act to move, and Taein Taein also prefer to stay or stay to move or to act or play. Taein the shape is thicker, heavier than Shaoyin. Shaoyang in is thin and easy to move or easy to act, and is and lead anybody. Okay, there is important subject to diagnose. There are many kinds of diagnose by pulse or the body shape or so many kind. I'm
So
not
the
professional.
Shao Tang will be relevant to the Tai-in or the Shaoyin people, or
In any case of body, it is helpful. Especially Taein is more is better than is better.
so this the most of the patient will suffer this more the dryness, no swelling. So when I encounter the back pain patient without the swelling, I would like to use the Tang. So
Okay.
the pulse quality also might be relevant, more the wiry and thin. And then tongue also gonna be more the dry coat and then more like a thin and short. Can it be, is it make sense? Or would you give us a suggestion about what's the relevant tongue and pulse relevant to the Tang?
Yes, if the tongue is pale and if the patient feels cool, then dosage is more important because the property of Balsao is cool. It's not warm. The property is not warm. So in case of the patient with cold or cough or feel then dosage is more important. Yes.
Okay, we have time for one more question or 5 minutes.
sleep apnea. So the Jacqueline was asking about the sleep apnea.
sleep apnea.
Oh, obstructive sleep apnea.
My PPT or
Is it the 샤오야간초탕 is relevant to the sleep apnea, 수면 무호흡증, or do you have some other the herb formula suggestion?
okay. I experienced some patient. So if that syndrome if the cause is derived from muscle contraction in pharynx or trachea, this 작약감초탕 will be helpful because Shao nourishes blood circulation and the body flow, and the 저간차 trigger stimulate tonify qi. Those function will be beneficial to recover that symptom. So if that symptom is associated with contraction of this respiratory muscle, then these formula will be helpful. But if that symptom is derived from the low pressure of heart, the heart rate is low, hypotension, then the stimulant of cardiac output is better because the function of heart is low. So for that case, quibitan is better because it contains ginseng radix, astragalli, or Ziziphus or Ziziphus jujuba and dangui. So it stimulates blood circulation. So the symptom, the cause of that symptom varies, differ from each other in many cases. So if the problem is derived from muscle contraction of respiratory muscle, then 샤오야간초탕 is beneficial. If the cause is derived from the heart, low function, then quibitan. So ginseng radix or astragalli will be beneficial. Okay, quibitan at the end of last year, I presented to your university. Yes.
Yes, last time the WSA, the student organization, invited Dr. Gonho Lee for the quibitan presentation. So if you're curious about it, and we also can share the contents. Okay. Oh yeah. Oh, thank you for your lecture today.
Okay.
Thank you.
Yeah. Thank you for your attention.
Thank you, doctor.
Okay. Thank you.
All right. So the next one will be in November. It's the same lecture, but we want to welcome Dr. Lee again in November. Thank you, Lauren, Laura, and Jacqueline for attending.
Thank you so much.
Thank you.
Thank you.
Okay. Thank you. Bye.
수고하셨습니다.
네, 감사합니다.